अस्सलाम वालेकुम, वेलकम टू द चैनल। आज का MCQ है an adult patient presents with chronic arthralgias and is noted to have bluish black discoloration pigmentation of the sclera and ear cartilage. The patient urine turns dark brown black upon prolonged exposure to the air. Laboratory testing reveals an inherited defect in degradative pathway of an aromatic amino acid. Which of the following enzyme is most likely deficient in this patient? ऑप्शन दिए गए हमारे साथ phenylalanine hydroxylase, homogeneous distrate oxidase, branch and alpha ketoacid dehydrogenase, dihydropterin reductase. Upon looking to the main points that has been given in the MCUs like bluish black pigmentation of the sclera and dark brown or black color of the urine, it points towards a defect, inherited defect in the amino acid pathway that is known as Alkaptonuria. And the enzyme that is deficient in Alkaptonuria is homogeneous oxidase. While why the other options don't fit, this is the number one phenylalanine hydroxylase is the enzyme that is required for the conversion of phenylalanine into tyrosine, while the branch in alpha ketoacid dehydrogenase is the enzyme that is required for maple syrup that is deficient in maple syrup disease and is required for the conversion of branch chain amino acids, while the dihydropterin reductase is also an enzyme that is required in phenylketonuria. Now, after solving this MCQs, let's go and study the topic from first aid so that you may learn it more and won't forget it ever. So this is the phenylketonuria topic. You can see here that the phenylalanine converts into tyrosine in the presence of phenylalanine hydroxylase or dihydropteridine reductase. For this enzyme, a cofactor is needed, which is tetrahydrobiopterin. If this enzyme is deficient, or either this enzyme is this cofactor is deficient, phenylalanine won't convert into tyrosine and it will accumulate. Phenylalanine and phenyl ketones like phenylacetate, lactate, and phenylpyruvate, these will accumulate in the body. Also, one thing to remember is that phenylalanine is a essential amino acid, mean you have to take this in the diet, while tyrosine is non-essential amino acid. But if this enzyme become deficient, the tyrosine become essential too. You have to take this in your diet. This tyrosine further converts into tyrosine, dopamine, melanin, and the dopamine further into norepinephrine and epinephrine. So as you can see, the tyrosine converts into melanin. So if this enzyme is deficient, the melanin won't be formed. As a result, you will see the hypopigmentation in the patient, and this can also be present in the question stem. Some MCQs may come in which this will be presented that a baby has with the intellectual disability, macrocephaly, and hypopigmented skin. What could be the possible cause? Also, another thing that is important to remember for you an MCQ point that dopamine when converts into norepinephrine it requires vitamin C. The only vitamin C that is required for the conversion of dopamine to norepinephrine. This can also come in MCQs, so remember it. Also, how to prevent this? So to prevent this, you have to avoid the artificial sweeteners because artificial sweeteners contain aspartame which convert into phenylalanine. Uh, so you have to avoid artificial sweeteners while you have to add tyrosine in your diet. You have to remember this thing also that phenylalanine this can also affect pregnant patients and it can cause fetal growth restriction, microcephaly, and intellectual disabilities. Now coming toward the another disease, the maple syrup urine disease. As I said, the enzyme that is deficient here is branch chain alpha ketoacid dehydrogenase, which is required for the degradation of branch chain amino acid like isoleucine, leucine, and valine. If this enzyme is deficient, this enzyme won't be degraded and thus will accumulate in the body. So how to avoid this? You have to avoid leucine, isoleucine, and valine in your diet, while you have to add thymine. Why? Because this thymine, as you see, this is required for this enzyme branch and alpha ketoacid dehydrogenase. We will study about this later, that the B1, the thymine enzyme, is required for four major enzymes that is used in various metabolic pathways. One of the enzyme is here, so you have to add thymine for this. Now, how this case presents in real life. So the main buzzword that comes up in question stem is maple syrup like or burnt sugar smell of the body secretions like urine, sweat, and earwax. All of the secretion would smell like maple syrup or burnt sugar. Now comes to the another one, that is Alkaptonuria. Alkaptonuria is because of deficiency of homogenous oxidase enzyme, which is required for the degradation of tyrosine to fumarate. Remember this. This can also come up in an exam. When this homogeneous oxidase enzyme is deficient, in the body, homogeneous acid builds up, which is a pigment forming substance. So result, it gives black color discoloration to the various body tissues like connective tissues, ear cartilage, sclera, and it make urine black and exposure to the air. So from this one MCQs, we covered up three main amino acid metabolism disorders. So to sum up this, you have also remember this important point, that all these amino acid metabolic disorders are autosomal recessive. So this can also come up in your exam. So you have to remember this. The major buzzword is hypopigmented skin or maple hypopigmentation or musty body odor. I forgot about that, but you have to remember this thing, that the phenylketonuria patient also has musty body odor. So these are the two buzzwords. And the design definition is phenylalanine hydroxylase. Vitamin C is required for the conversion of dopamine to norepinephrine. While maple syrup disease, the maple syrup or burnt sugar is the buzzwords, and remember about B1 thymine supplementation, while in cryptoruria, black color discoloration is the buzzword. Thank you for your time.